Herd at Health is sponsored video content brought to you by MedCity News.
Hi, welcome to Herd at Health. I'm Marissa Plesha, reporter for MedCity News. I'm very excited to be here with Zane Burke, CEO of Quantum Health, a healthcare navigation company. Thanks so much for joining.
Great to be here, Marissa.
So tell me, employers are reporting an almost 50% increase in pharmacy spend, and to solve this, you recently launched a pharmacy navigation solution. Can you tell us a little bit about what this new offering looks like?
Sure, well, we've been providing pharmacy cost savings around the medical side for quite a while on kind of within the medical spend, saving $2.11 per member per month. But what we're seeing is on the pure pharmacy side, those costs have gone up dramatically, and almost 75% of the increase in trend, which is expected to be about 8 to 10% total trend, is on pharmacy specifically. So it's a major pain point for employers and payers as we look forward. We are uniquely offering a pharmacy navigation solution which attacks in particular the specialty meds. So these are really these high cost meds used by a small fraction of the employee base, but you have an opportunity to step in and provide some alternatives and to really create a different kind of experience. So for the members, such that they don't get caught in the wash, because oftentimes what happens, these meds get prescribed, they can't get them filled, they finally get them filled and the costs are exorbitant, the employer on the backside can't rationalize it. What we can do is engage early, upfront with the provider, with the member to go after these specialty meds. Maybe it's taking the member to a biosimilar at that point in time. Maybe it's impacting whether the medical necessity of that. But working with our clients to really go after that pharmacy spend on the specialty side, and uniquely engaging with the member and with the provider to intercept that script and to make a difference at the point of care, such that we can go after those costs together. That's what we announced about 5-6 months ago. We've got a couple clients that are lined up on that. You'll see us also coming out with some things around the GLP-1 elements, which unfortunately many of our great drugs for the right audience. And I think that's the key part, is employers are struggling with who's the right audience, how should I be thinking about this from a step up, a step down, how do we not use these as weight loss, just pure management drugs, and use them for what they're intended to, which is really to go after those that are in need and appropriately can utilize those services. And we'll launch that here with the 2025 selling season.
Yeah, that's great. And can you tell us a little bit more about what specific pain points this really solves for employers? So
employers are trying to figure out how they give these, world-class drugs, new drugs to their employees, but do it in a manner that's cost-effective and efficient. And oftentimes what you'll find is there's alternatives. So for instance, take a drug that was $200,000 and put somebody on the $120,000 a year drug? That sounds like a heck of a lot of money, but that still saves $80,000. There's a lot of those kind of alternatives in the specialty meds. And so you're trying to go after that pharmacy cost side, which has gone up significantly over the last several years.
Yeah. And what results have you seen since launching? You said it was about 5 months ago. What results have you seen, and what's next on the pharmacy front?
So for us, we're seeing our clients are beginning to, they've gone after the identification of those medications. They've gone after some plan design changes such that they can decide how they, what they cover, what are they going to put some new gates in, how can they utilize our services to step in and create that. The early returns are very good from an experiential perspective. So how do you make sure the member still has a great experience? Because oftentimes these become, kind of sticks versus carrots. So how do we make it so it's a positive environment for the member? How do we make it so the providers are smarter on that side? And so early returns we're seeing great experiences with the a hard ROI around those pieces. But it's early in the game, and so I'll be looking forward to sharing more specific information around that in the future.